The California Department of Healthcare Services estimates 63.5 million people nationwide are on Medicare, and more than 10% of those are right here in California. Well, as of course, in Oasis, where a lot of people come to retire, chances are you know someone who's on Medicare. Maybe that someone's you. This could be a good time to educate yourself because Medicare's goal is to ensure all Americans have access to the medical care they need. Of course, at an affordable cost, right? To help put your minds at ease. Stick around because we are here to educate you on everything you need to know about Medicare. This is The Pulse.
Medicare. Some people feel like they fully understand it. Others feel like they have a general grasp of it. And yet still others out there, many others in fact, don't fully understand Medicare and how it impacts them and their families. So today we are here to break it all down. It's okay. We have 3 Medicare plan advisors. Thank you all for being here. We're going to start with Jeremy Proctor, Bill Proctor and Associates Insurance Services. We have Marv Law from Health Bridge Insurance Solutions and Brian Billhartz from Billhartz Desert Insurance. It's a mouthful, and today's a mouthful. Let's just call it what it is. Medicare can be confusing.
Yes.
And we said, this isn't going to be an interview. We're not going to call this an interview, a conversation. And you even told me, Brian, that you have clients who educated people are confused by Medicare, yes?
Yeah, absolutely.
I mean, people that are educated and doctors and lawyers and CEOs.
Yep.
Okay, so we don't want anyone to feel intimidated, and we want it to just be a conversation. So simply put, let's just start. How would you explain Medicare?
Well, Medicare is generally for health care for those who are 65 and over. Unless there's a disability, they may get it early. And it's really there for the different parts to cover hospital and medical and sometimes other benefits as well. So it's really health care in retirement or for over 65.
And we'll break down all the parts later. When is somebody eligible for Medicare?
Typically at age 65, you could qualify prior to age 65 based on some certain medical diagnosis.
Okay, and I understand you use a broker to sign up, and you guys were saying there's a pro to use local brokers, right? What is the benefit of that?
You have someone locally to talk to that knows the local doctors, medical groups, kind of knows the ins and outs, knows contacts of people when problems arise to find solutions instead of just a random 800 number where somebody may be going to assign you to the wrong doctor, the wrong medical group, which can cause a lot of issues down the road.
Okay. I think we'll end at the end about how to sign up because that'll be kind of like our button on all of this, but shall we take the deep dive? Okay, let's do it. Okay, so I understand Medicare's 3 parts, and parts are different than plans, yes? Can you explain that?
Right. So Medicare has 3 basic parts. Part A is hospitalization. Part B is for outpatient for medical. And then Part D is for prescription and drug coverage. And then Part C, is actually taking all of A, B, and D and putting it in one medical plan.
And that's called the plan. Okay,
Yeah.
So we'll start then with the first part, right? Hospital insurance, Part A, what does this include?
Yeah, so Part A is, I like to refer to it as your inpatient coverage.
Okay.
Because anytime you're in like an inpatient setting, skilled nursing facility, inpatient hospital, even home health care services can be covered under Medicare Part A. So Part A has deductibles and co-payments, based on the service that you receive.
And most people do not have to pay a premium for Part A, is that correct?
Correct. You have to have 40 working quarters or credits to qualify for premium-free Part A.
What does that mean exactly?
So paying your Medicare taxes, having the deductions from your payroll.
So if you're retired, basically 65, Part A should be free in theory.
In theory, but not always.
There's always exceptions.
Yeah.
Right, okay, but for most people we would say it is for the majority, yes.
Correct.
And then Part B, medical insurance, what does this cover and what is the cost for Part B?
So Part B is outpatient. So everything that's done medically, testing and diagnostic and doctor visits, while you're not hospitalized. And so the cost for that, the standard cost this year is $164.90. It's going to go up a little bit in 2024. And unless someone is at a poverty level, then they'll pay that $164.90. And then people with higher income can pay more than that. There's a sliding income scale.
And if I understand correctly, when you turn 65, Part A, you automatically are eligible for. Part B, you have to elect, correct? It doesn't
Yep.
happen automatically.
You
'Cause
have to
pay.
enroll in it unless
Right.
if you're already taking Social Security at the time, they auto-enroll you in Part B, A and B, unless you refuse Part B, which some might do because they're on an employer plan.
Okay.
Yeah. Otherwise, they do have to enroll in Part B through the Social Security office,
All right.
either online or in person at the local office.
Okay, and then Part D is the prescription drug coverage portion. Do you have to buy a separate drug plan? How does that work?
Yeah, they're standalone drug plans, as they're usually referred to. They have usually a 5 to 6 tiered system with set co-pays until you go into the coverage gap, and donut hole, as a lot of people refer to it.
So I had asked when I was doing some research about this, so Part A, B, and D, we just explained that. I said, why can't you just leave it at that? But is that when you're considered technically underinsured? You have to now forge the two paths and take left or right. Is that right? First of all, why is that? Why are you considered underinsured if you were just wanted to stay with A, B, and D?
Well, because when you really get into the dirty details of primarily A and B, because D is a whole separate beast on its own. But like I mentioned before, with Part A, if you just have original Medicare without any other coverage, if you're admitted to the hospital, you have a $1,600 deductible that you're responsible for up to the first 60 days of that inpatient hospitalization. And then if your stay is longer than that, there's daily amounts that accrue as well. And with Part B, it's typically 80-20 coverage, where Medicare covers 80%, and the member's left with 20%. But the question is, how much?
That could be a lot, right?
Yeah, that's right.
Okay, so then you need to get further coverage. You need to essentially go left or right, we'll call it. You have two options. Can you explain our options here of what could happen next?
The options are to stay on original Medicare, A and B, and add a supplement, and then add a Part D. So there's like 3 parts, kind of like an a la carte, right? You pay a premium for each one of those. The other path is what they call Medicare Advantage, or Part C, and it takes all of the other side over, puts it in one plan. And often they can cover other benefits not covered by Medicare because Medicare is paying the plan, and then the plan includes A, B, and D, and they're able to add other benefits as well as reduce the out-of-pocket expenses that people are experiencing if they only have A and B.
I do understand a downside, if you will. We want to be completely honest with people and do all the different angles here. If you're on Medicare Advantage, you do have to stay in network. Not saying that's a downside, but that is a truth to it, correct? Can you explain that a little bit so people understand that transparently?
Yeah, so most of the Medicare Advantage plans are HMO plans, though there are a few that are PPO. But when you choose an HMO plan, you do have to select a primary care doctor, and that primary care doctor has to be part of or affiliated with the medical group. And then all of your care is handled within that group.
I understand with Medicare Advantage, you are covered in full, but you do have to stay in network, right? For in-network doctors. So let's say somebody says, I want to have access to a doctor in LA or Orange County. Your alternative is to get supplemental insurance. Can you explain that a bit?
Correct. That's considered a Medicare supplement or Medigap. And what that does is it helps cover any deductibles and copays that would exist on traditional Medicare. So, for example, it would cover that hospital deductible we talked about earlier of the $1,600. Your Part B deductible, that one you're still required to pay out of pocket at $226 for the current year. And then after that, the plan would cover generally all your other medical costs for the rest of the year, with the exception of prescription drugs.
So how, if somebody's watching right now and saying, I don't know which, path to choose, what would you advise? I know you don't know anything about Susie that's watching and wondering this right now, but at a high level, if they're not sure to do supplemental insurance or Medicare Advantage, what are some things that they could think about to help them make that decision?
So it often depends on the doctors that they're already using, their specialists, their primary care doctor. There's never a single path and plan that's right for everybody. So it really depends on even sometimes prescription costs. I've seen people who have said, I only want a Medicare supplement until they saw the cost of their prescription coverage on a standalone Part D plan, and they saw how much they could save on the Medicare Advantage plan. Surprised me and said, I want to do a Medicare Advantage plan because that monthly expense on the prescription cost. So sometimes it's prescription cost. Sometimes it's the doctors they want access to. And others don't want to have to coordinate their care on their own, figure out what specialist do I go to, and that type of thing. And there is an advantage to having a medical organization that kind of helps you coordinate that care where everybody's on the same page. And that takes a lot of pressure and anxiety away. So it really kind of depends on whether someone wants to take charge of their medical care and kind of coordinate it themselves, or if they're willing to give up access to some doctors and maybe have somebody assist them with coordinating that care. Still getting great care, but within the network.
Is it accurate to say then Medicare Advantage would always be a cheaper option than getting supplemental insurance?
Yes.
Yes. And Brian, I'm curious, we know the healthcare landscape is ever evolving. I take it and presume that means Medicare is evolving and rules. And just how would you suggest people keep up with all of this?
You know, that's our job.
Okay.
I mean, as the health plan advisors, that's what we do. And in fact, right now, we're going through studying and learning, you know, all the changes, because these plans can and do change year over year. New plans are introduced, old plans are removed. So there's just this constant evolving. So we don't want any of our viewers to depend on themselves because we are available to them at no cost. They don't pay us any fees, but we'll give them all of our advice, our knowledge, our experience to help make this decision as simple of a process as possible.
Okay, let's take a quick moment now to recap what we just talked about on Medicare and how Desert Oasis Healthcare as a medical group fits into all this. Although there are some exceptions, Medicare is designed as healthcare coverage when you turn 65 and retire. You just automatically receive Part A for free if you've paid enough into it through the taxes taken from your paychecks over the years. Part A is provided at no cost. It covers inpatient care such as hospital stays, nursing facilities, and home health care. But for everyday medical needs, there's Part B in which you have to enroll. Now, it's not automatic enrollment like Part A, to be clear. Part B covers outpatient care like your doctor visits, testing, and diagnostics, and it comes with a monthly premium. For prescription drugs, you'll need to purchase a standalone Part D drug plan from an insurance company directly. Most Medicare Advantage plans include drug coverage, so you wouldn't need to purchase a separate plan. If all of this seems like a lot to handle, don't worry, you're not alone. Desert Oasis Healthcare uses independent agents to help you find the Medicare Advantage HMO plan that might be right for you. Medicare Advantage combines Part A, Part B, and Part D with no additional premium. So this essentially keeps your monthly cost down, including out-of-pocket expenses, and it makes it easier for you to get the care you need. You get everything in one plan instead of dealing with many separate parts and premiums. Plus, Medicare Advantage offers benefits not covered under regular Medicare, such as dental, vision, hearing, transportation, and more. You might be wondering, what's the advantage of having a Medicare Advantage HMO plan with Desert Oasis Healthcare? Well, DOHC is a medical group that provides everything you need under one roof, much like the Medicare Advantage program. They have a wide network of doctors, specialists, and services, and all of these members of your care team work together to care for you. DOHC also has exclusive programs for members that other medical groups just don't offer, such as the Wellness Clinic. The Wellness Clinic helps you stay on top of your health and keeps you on track. It also provides a prescription management program offering education and counseling for the prescription drugs you need. There are also many other programs at no cost to those on Medicare Advantage with Desert Oasis Healthcare that help you live your best life. DOHC works with independent insurance advisors such as Jeremy, Marv, and Brian to ensure you get the right plan. Each one of them are local right here in the desert, and they help you answer all the questions you might have about Medicare. Desert Oasis Healthcare, of course, is also available to answer any questions you have and point you in the right direction. You can call 760-320-5134 or visit mydohc.com. All right, now let's get back on set to talk about how those Medicare advisors work with Desert Oasis Healthcare to give you the best healthcare experience.
So a lot of people watching are people who are currently on Medicare, but then there's also younger people, myself, you know, in our 30s, 40s, that might think, gosh, 65 seems so far away. I don't need to know about this. 2 points, which I've learned, not only because I'm conducting this episode and this interview, but my parents are 65. For all of us, we want to know Medicare before we turn 65, right? Not trying to learn it all when you're 65. But also, we want to be able to help our loved ones and communicate for them, with them, advocate for them. Can you explain that a bit?
Yeah, when we meet with a Medicare beneficiary, we try to encourage family members to join and participate as well so that they can learn, because there's so much information that we go through. So much of it can be missed. And so we want to make sure that as many ears are listening as possible, that the family members are involved, because we've all seen too many cases where these people are alone, they have grown children that aren't vested and aren't involved, and sometimes we become their adoptive children in a lot of ways. And, we just love what we do and the people that we serve, and we want to make sure that, as many people are involved as possible, because it is a pretty heavy decision.
That's interesting. I never really thought of that perspective. That is heartbreaking to hear. I mean, they must then be asking you questions that it's probably not even your job to answer, but you want to kind of help steer them in those directions. How do you navigate that? I'm curious.
It's just a case-by-case basis. Some people
side,
need a daily handhold, you could say, of walking them through the steps of how to make an appointment with your doctor, how to check on referrals. The biggest one a lot of times is my prescription now costs $400 and it used to cost me $35. And that's a big thing that we kind of have to walk them through and go through those explanations again of why this is happening this way, and then turn to find possible solutions out there that's just not readily available, but maybe diving deep, you can find some solutions that might help them out in the long run.
So how do people sign up then for Medicare if they haven't already? They're watching, they want to understand that process.
So if they're tech savvy, they can do it through SSA.gov, Social Security Administration.gov. Okay. And they can sign up for Medicare only. They don't have to do Social Security at the same time. It requires them, of course, to have a password and a username. Or they can go call Social Security directly and set up a phone appointment, or come into a local Social Security office to sign up.
I sense not only a level of compassion from you all when you, like what you said, Brian, about people that maybe don't have kids to help them through this process, but also I could tell you all have patience, which I presume is important in this, your job. But what would you just like people at home who just watched this, maybe hopefully you all have a better grasp and understanding, but they still feel a little hesitant. I don't know if I fully understand. And do I make the call? They just need to make the call and ask the questions, right? Yeah,
we come across so many people that we walk into their lives and they say, well, I've talked to my neighbors, I've talked to my family members, I've talked to friends, and they all say this is what we should do. This is the decision I should make. And we kind of pause and say, well, wait a second, we're the subject matter expert. We're not here to do harm. We're here to help. And if that does turn out to be, what's best for you, then by all means, that's the path we'll go. But let's just make sure. Let's make sure we're dotting our I's and crossing our T's, especially like Jeremy had mentioned with the Part D, the prescription coverage. I mean, there's such a variation from one plan to the next on how they cover medications. So it's just something you don't want to gloss over. You want to make sure that you get down into the details of the plan to make sure it's going to be the most effective one for that plan year.
One more question about the two paths people can take if they want to go the supplemental insurance route to cover that other 20%. How do you get supplemental insurance? Who do you call?
So supplemental insurance plans and Part D are all offered through private insurance companies. And so you can, again, talk to a local broker that contracts with many different companies to look at the different options, talk about that side versus looking at what are my costs and expenses on the Medicare Advantage side. Never matters to me what our clients enroll in. We just want to make sure it's the right fit for them. And so when they leave our offices, we want them to have clarity and a certain level of comfort and understanding so that when they start to use their plan, it'll work well for them. We want them to be our clients for life, and so we want to make sure it's the right fit for them.
I know my dad said when he was deciding which path to take to get that other 20% covered, his advisor said, if you're a relatively healthy person, you could, go down the Medicare Advantage route because the specialist, everybody is in-house, right, in network. But if maybe you're somebody who struggles with health a bit, or has other issues to do the supplemental insurance route. Is that accurate, or?
It can be, but not always, because kind of that coordination. If you have a whole team of professionals who are providing care and providing direction for you, some people are better off receiving care that way rather than on the Medicare supplement trying to shop for specialists and doctors. So it really depends on the individual, and also if they have the means, the financial means. Because it is more expensive to have the supplement. And as people age, the supplement premiums increase in monthly premiums, whereas the Medicare Advantage plans and the drug plans the premiums aren't related to age.
I see. An interesting note, if you choose the Medicare Advantage route, you do get some extra benefits. Can you explain that?
Right. So if you're on the Medicare supplement side, the supplements only cover or help pay for what Medicare pays for. Medicare doesn't pay for dental, vision, hearing, groceries, other benefits. But Medicare Advantage plans are allowed to do that. So Medicare pays the plan, and then the plan designs it, often including those benefits, dental, vision, and they can come in different forms, so different plans have different levels of benefits in those areas. That's why it's important to use a local broker to kind of navigate through that aspect of their Medicare Advantage plans as well.
So I understand choosing a local broker is important, but not just that, choosing a local medical group. For example, Desert Oasis Healthcare, they've been here since 1981, one of the first medical groups in Southern California. Why is that beneficial to choose a local group?
Well, it's beneficial because they have generally more providers involved. They have a lot more experience and time contracting doctors, contracting specialists, and a lot of medical groups might just have a few primary care doctors to choose from. And some of the care, they may have to go out of the desert to find specialists and so forth. So to have a locally based, experienced medical group can be very important when choosing your Medicare Advantage plan.
And that is essentially a benefit of choosing Medicare Advantage, right? Because you have that care coordination?
Yeah, absolutely. I mean, I have stories of people that have been on Medicare supplemental insurance plans that when they started getting sick and needing more care and more services, it was very overwhelming to try to navigate and figure out which providers they needed to see for their specific condition that was going to help address, whatever their needs were. But then even beyond that, coordinating that with their primary care doctor was very, very difficult.
So you get that care coordination, medication management, which a lot of people need that assistance with, and just a very robust network with Desert Oasis.
Before we wrap up this episode of The Pulse, let's recap the key points. Brian, Jeremy, and Marv are here to help you navigate the world of Medicare. They serve as advisors, and they can help you in setting up your Medicare Advantage plan. You can easily just reach out to them using the contact information right here on your screen. And remember, their services are entirely free for anyone seeking the right Medicare coverage. Their interest is in making sure that you get the health plan that's right for you. All three advisors stressed the importance of being well-informed when making decisions about your health care. They also highlighted Desert Oasis Healthcare, or DOHC as many know it as an excellent choice for your medical needs because they know DOHC is committed to providing high-quality care to all of its members. And during this annual Medicare open enrollment period from October 15th through December 7th, their help will be especially beneficial to a lot of you. Medicare Advantage plans accepted by Desert Oasis Healthcare offer a comprehensive range of extra benefits like dental, vision, hearings, gym, and transportation. When you're with DOHC, you'll also gain access to their extensive range of services, including medication management, foot care, home health, immediate care, wellness clinics, outreach services, and a whole lot more. In short, Medicare Advantage with Desert Oasis Healthcare offers better value, better services, and better care.
Okay, so then to bring it full circle, when you turn 65, you automatically are eligible for Medicare. You become Part A automatically. That's free. That's hospital insurance. You do have to elect for Part B, right, which is about $165 a month. And then the two trees, if you can explain that, our two branches, I don't know why I said trees, our two little paths, if you will, break them down in a couple sentences of the two options people have.
So you can't have both. We often get
Correct.
calls where, hey, I have this, can I add a supplement
Yes.
to that Medicare Advantage plan? You cannot. Either you go down the path of using original Medicare with a supplement to help pay out of pocket, or you do a Medicare Advantage plan that's kind of an all-in-one plan that helps manage and coordinate care.
And that's to be able to get 100%
And those are
coverage.
often zero additional premium above your cost of Medicare.
It was such an enlightening conversation. It seems so evident there are strong benefits to using local brokers like yourselves, but also a local medical group like Desert Oasis Healthcare to really help manage it all and keep it in the family, if you will. Thank you for not just explaining all of this, but I'm sure all of you at home can feel this. You lead with love and compassion to the people that you're working with. And I truly hope everyone at home has even just a little bit stronger of an understanding of Medicare, but clearly you see you have great people to call if you need a better understanding. And on our website and the Studio DOHC podcast, there's a deeper dive into Medicare as well. So thank you all for being here and talking to us more about this.
Thank you.
Thank you.
Desert Oasis Healthcare is not just a healthcare provider, it's your partner in making informed decisions about your well-being. They believe that knowledge is power when it comes to your health, and that's why they're dedicated to offering you more than just medical services. They're here to educate and empower you. Visit their comprehensive website, it's mydohc.com, where a wealth of health information is literally just a click away. From tips on managing chronic conditions to healthy lifestyle choices, it's all here at your fingertips. DOHC is constantly updating the site to keep you informed about the latest advancements in healthcare. But that's actually just the beginning. You can also join their Medicare seminars held throughout the Valley, including the High Desert and even online. These events are designed to guide you through the annual open enrollment period, ensuring you make the best choices for your healthcare needs. DOHC can also help you connect with a local advisor like the three we spoke to today, who can provide personalized assistance at no cost to you. And you should also check out the podcast, where DOHC takes a closer look at the intricacies of Medicare. You'll find expert insights, real-life stories, and valuable information that can help you navigate the complexities of healthcare with confidence. DOHC knows you might have questions, and they're here to provide answers. If today's episode has sparked any queries for you or a loved one, just don't hesitate to reach out to Desert Oasis Healthcare at 760-320-5134. The team of dedicated professionals is always ready to help. As we conclude, remember, Desert Oasis Healthcare is committed to your well-being and education. They look forward to sharing more valuable information with you in the future. Until next time, be well.